had somebody, a colleague, or someone that came in and they were pale, cold, clammy, feeling sick, feeling thirsty, feeling pretty awful. They took quite a sense of impending doom. Chances are they might be having a heart attack. They may or may not have pain down the left side. It could be as little as toothache or nothing at all. Some diabetics don't have any pain at all. Or it could be the worst crippling pain you've ever felt in your life. The signs and symptoms that you're seeing are those of shock. So pale, cold, clammy, feeling sick, feeling thirsty are the signs of shock that alert you that there is something serious going on. What you should do is sit them down on the floor, because the chances are that they may end up collapsing and you may need to resuscitate them. And you cannot resuscitate someone on the sofa because it's too squishy. So if you need to resuscitate someone, they need to be on a really firm surface. So sit them down on the floor now, and you would sit them down in the lazy W position. You sit them in a position with their knees bent up a little bit, give them a little bit of extra blood, not too much, and it's a really nice relaxed position for the heart to be in. And you obviously have something rolled up underneath to support them. You sit them down in the lazy W position with something rolled up under their knees to support their knees, and you upright to help them because you're upright when you're breathless. Okay? If they have a GTN spray, so they've had a heart condition in the past and they've been prescribed this, then you would help them to take their GTN spray and spray it under their tongue.
What does that do? Does that open?
Yeah, what it does is it relaxes the coronary arteries here, which have got tight. So that's what's happened. What happens is you've got your plaque building up. Where are we? Find it here. You've got. I've got it here somewhere. Maybe I haven't. You've got your coronary arteries with the blood going through, and what happens initially is that they start forming atheroma or cholesterol deposits inside. Those cholesterol deposits start filling it up, and then they can sometimes end up getting a bit damaged on the top, and then it can bleed. And when it bleeds, you can get a clot inside, and that's when it blocks it completely, which is your heart attack. So when it's angina, it's when it's really tight, and the blood's struggling to get through. And if you take the GTN spray, it relaxes this a bit, relaxes those little vessels, so it opens them so that the blood can get through, so that the blood can get through to the muscle, because the pain you're experiencing is the heart muscle.
And how long, like short term, long term is that? Would that be enough time to just get them to A&E or?
Oh yeah, if they feel better, it's dilated and you can take them down to A&E fast, so the pain will ease.
Okay.
If they don't feel better, they're probably having a heart attack.
Okay.
So if they don't feel better, if they've been prescribed a 300 milligram aspirin, then you would get them to chew it, because what that will do is start working on these coronary arteries and actually work on the clot that's blocked there and start breaking it down before they even get to the hospital.
Are they supposed to carry these things around with them?
Yes, they are.
Okay.
They are. So anyone that's had history of angina will have their GTN spray and their 300 milligram.
You wouldn't though give them your own aspirin if you had.
No, because they could end up being allergic to aspirin,
Yeah.
or they could be on warfarin, or there might be some contraindication. So if they've been prescribed it, they take it. It's the same with all medication.
Yeah.
You are not prescribing anyone else, not rummaging in your handbag. So if they're sitting up like this, you help them to take the GTN spray. If it does work, you ship them off to hospital. It's probably an angina attack, but you ship them off anyway just to be on the safe side. If it doesn't work, ambulance is definitely on the way. They're chewing their aspirin, and if they suddenly go and collapse, then you will need to push hard and fast on their chest. So Where you are going to push is right in the centre of the chest. If you go feeling down here, squishy, 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 so you get to the bony bit at the top here. Yeah? Mm-hmm. Then you go from the bottom, squishy, 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 and then you get to the bony bit down there. Yeah? Mm-hmm. Right in the middle of those. That's where you want to be. And you need to be pushing down 5 to 6 centimetres.
Gosh.
To push down hard enough to be doing cardiac massage. That is what you are doing. So when you are pushing on the chest, you are being the heart for them because it is not working properly.
Will that break there?
If somebody is over the age of about 25, it's all downhill from 25, everyone. So if someone is over the age of about 25 and you are doing this properly, you will crack ribs. You will hear them crack, you will feel them crack, and you keep going.
Is there danger of like puncturing the lung or anything?
Got 2 lungs.
Oh, okay, fair enough.
It's usually a bit of cartilage that gives.
Okay.
I guess you're dead if you don't do it, aren't you?
Yeah.
Yeah, they're unconscious, they're not breathing. When you get to the point that they're unconscious and not breathing, anything you do is pretty much is better than nothing.
Ribs here as well.
Yeah. Yeah, so do not worry about it, but it's important that you know, because when I first did it, I was in casualty. And there I was, pushing on the chest, hard and fast, and it went crunch, and the registrar over there went, "It's all right, Em, that was a rib, keep going." Whereas if you were on the high street and it happened, you'd think, "Ah, my goodness, what have I done?" So important that you know. You keep going. You are not going to break ribs in babies or children because everything's far too bendy and flexible. And the 16-year-old I was telling you about earlier, I mean, she was much more like resuscitating a child. Again, everything's still very pliable. It is from 25 onwards, guys. And it's all downhill from there. So, heel of your hand in the centre of the chest. Fingers either like that or like that, doesn't matter which. And you will need to do press-ups on top of them. So up like that, up over the top, and you need to be pushing down 5 to 6 centimetres and pushing down at 120 beats per minute. So 1, 2, and don't forget, real people do not click like that. So you'll be pushing down like that, okay? And you need to keep going hard and fast. Now, in an ideal world, we would be pushing on the chest, because pushing on the chest is pumping the heart, is keeping the heart and the brain full of oxygenated blood, and it's keeping everything moving. However, research has shown that after about 30 compressions, you start to run out of oxygenated blood, and you'll be pumping deoxygenated blood round. So that is why the advice is 30 compressions to 2 breaths. 30 to 2, 30 to 2, 30 to 2, 30 to 2. When you are pushing on the chest, you're being the heart. When you're breathing into them, you're being the lungs. So you're being a heart and lung machine, a life support machine, and you are keeping them alive. Okay? Now, people keep saying, "Oh, can we do without those breaths?" Not if you want to give someone the best chance, and certainly not when you're resuscitating babies and children or someone that's had a breathing problem. But if you came across someone in the street, an adult that had collapsed, and you were unable, because maybe you've got horrendous asthma and you physically can't breathe into them hard enough to inflate their chest, or they are in such a state that you think, "Do you know, I really can't," then pushing on their chest is better than doing nothing at all. It will probably give them 3 to 4 minutes that they wouldn't otherwise have. But it is not giving them the best chance. To give someone the best chance, the advice is still push hard and fast on the chest, 30 compressions to 2 breaths. So when you're giving the breaths, 2 fingers under the chin, 1 hand on the head. You have to tilt the head and lift the chin to open the airway, because otherwise you're not going to get the air down because the tug will be on the back of the throat. You then need to hold the nose, because otherwise you get bogies on your cheek and you won't get the breath down where you need it. And you seal round and you breathe into them. 2 breaths, straight back onto the chest again. 32, 32, 32. If the chest doesn't rise, you probably haven't opened the airway enough. If they start to gurgle, they're lying on the back, the contents of their stomach are trickling up. You're going to have to empty them out and give them a wipe. Which is why you might want to carry some sort of a face shield. I always have one of these in the car. I have a duty of care to stop, and I don't want to get too cosy with them. They call itself a pocket mask. Presumably you use them as well. Do you have little ones?
Yeah.
Yeah, so you've got your baby sized ones as midwives. And you tilt the head and lift the chin. And then straight back onto the chest like that.
Just blowing. Like
Blowing
that.
into them like a balloon.
Okay.
If you haven't got one of those, then you might want one of these little key rings that has one of these inside, which again can be used as a face shield to give yourself a bit of distance. If you haven't got that, you can breathe through a cardigan, you can breathe through a t-shirt, you can breathe through a plastic bag with a hole in it. Anything that you've got that can give yourself a little bit of distance that can make you think, I can do this. You're not likely to catch anything that's going to do you major damage. TB, SARS, most people haven't got that. But it's really not very nice. So give yourself a little bit of distance and then you can go for it. Or think ahead and get something that can...
My friend, she used to be a first aider working for like Topshop, and they used to have this small, I don't know what it was like a, it wasn't a bag, it was almost like a face shield, but it was really small.
Yeah,
It didn't go over the nose, it just went on in the mouth, so she still held the nose, but just blew like a
whatever,
dummy size almost.
whatever you want to use.
Oh, okay.
It does the job. For a baby or child, it's far more likely that they have had a breathing problem. So it's much more likely that they've choked, they've drowned, they've suffocated, they've had some sort of breathing problem, and the heart stops afterwards. So they've had a respiratory arrest and then a cardiac arrest. Which is a good point about looking for a pulse. Don't worry about a pulse if the person is unresponsible, unconscious, and not breathing. Because if you've got to the point that they're unconscious and not breathing and you're now looking for a pulse, you're looking, oh, hold on a minute, oh, I have found a pulse, fantastic. But it still doesn't change your management because they're still unresponsive and not breathing, so you still need to resuscitate. So you will, if they're unresponsive and not breathing, you are going to resuscitate. If you're not sure, sometimes you can get a situation where somebody is sort of doing a, and you wait, and you wait, and you wait, and then they do it again. If you get less than 2 breaths in a 10-second period, you should assume they're not breathing and you should resuscitate. It is better to resuscitate someone that doesn't need it than not to resuscitate somebody that does. So, if you're not sure, resuscitate. They've done research looking at people that have been resuscitated when it wasn't strictly necessary. And they've discovered that nobody's died as a result. They might be a bit bruised, battered, they might have broken ribs, but nobody has died. They might be in a different rhythm than they started off with. But you can't stop someone's heart by pushing on the chest, and you can't start someone's heart. You can change the rhythm, but you can't stop and start.